What is tickle liposuction? Tickle liposuction is an office-based procedure that is unique in its gentleness. Tickle liposuction was first developed in Europe about 12 to 14 years ago and then was brought to the United States. Tickle liposuction is very unique because of its gentleness, utilizing a vibration and rotation mechanism. This mechanism also makes it quite comfortable. Tickle liposuction is unique that it doesn't cut, burn, or remove chunks of tissue that can be deforming. Tickle liposuction is gentle that it extracts or removes fat in the designated areas. Tickle liposuction is a very minimalized procedure where you do not require general anesthesia. The incisions are very small, about the tip of the white of my pinky nail. That's how big the incision is. It's a common question that people have. Also, do the scars remain? They're very, very small. In fact, they fade very quickly within a few months. Depending on the area that we do, how many incisions are made, could be anywhere from 2 to 3 incisions. Tickle liposuction is the preferred mechanism for body contouring. It is the most up-to-date and it is very comfortable. It's done in an office versus a hospital procedure. Tickle liposuction utilizes very small cannulas, about 2 to 3 millimeters in size. This is a great advancement from the traditional liposuction, which required general anesthesia. The tickle liposuction cannulas that are very, very small and vibrate and rotate are also able to remove the fat, yet maintain the structures of the muscle and the soft tissue attached to the skin, which creates less destruction, faster healing, and more comfort for you, the patient. This is an advantage of tickle liposuction. The anesthesia portion, which creates a very comfortable process for the patient, is that the tissue is sprayed with a lidocaine substance that is gently infused in that very, very small incision. Once you are numb, then the rotation and vibration starts. What's interesting is that the vibration also helps with the anesthesia. It not only mixes a lidocaine, but it doesn't cause any pain. Heat and cutting causes pain. Vibration doesn't cause pain. So tickle liposuction is very comfortable. It is safe, and it can be done in an office procedure. It is a minimal invasive procedure. It is not a huge surgery where you're under the risk of blood transfusions, volume shifts, and requiring general anesthesia, which creates downtime. What are the advantages of tickle liposuction? The mechanism that is so gentle and allows for an office-based procedure is that tickle liposuction allows for more efficiency for the surgeon. Tickle liposuction allows for better body contouring with better control, as opposed to the old-fashioned liposuction with the very large cannulas. Another advantage is less tissue destruction, which means less swelling, faster healing, and less discomfort for you, the patient. Also, tickle liposuction, because it's done or performed under local anesthesia instead of general anesthesia, will be a lower cost for you. Another benefit is that tickle liposuction allows for better, more efficient contouring, otherwise known as sculpting. So it allows the surgeon to sculpt the desired area much easier, safely, and more effectively. Warm office versus cold hospital. You may have had a procedure before where you enter the hospital, you're nervous, you don't know where you're going. You enter the pre-hospital setting. You're given a gown. You're next to people who are on monitors or receiving different procedures, and you're hooked up to a monitor. Several people ask who you are, what your name is. They check your band. That's a very cold setting. It's very impersonal. It's very intimidating. It's a large setting where people don't know who you are. Then you're brought to a large operating room, and it's cold. It's even colder where you started. And once again, people ask you different questions. What's your name? Who are you? What procedure you're having? And you're basically a person having a procedure amongst other people having procedures right next door with all these monitors and sounds. That's not very warm and inviting. Having tickle liposuction in a warm office setting is much more relaxing. Your staff has already met you. We're expecting you. You're placed in a warm, comfortable bed. You're safe. There are no monitors beeping all throughout the procedure. We know who you are, and you're comfortable. You know what to expect. And this is much more relaxing. You don't require all the cold, austere environment. You're in a nice, safe, clean setting. The cost of tickle liposuction. The cost of tickle liposuction is far less expensive than the traditional liposuction. You don't have the general anesthesia cost, the pre-op holding, the operative cost, as well as recovery time, and in addition, possible hospital stay. In tickle liposuction office-based, it's minimally invasive, therefore you don't have all the costs of general anesthesia. In tickle liposuction, the cost is bundled and all-inclusive. It includes your nurse, your doctor, all the procedure time, and also all the follow-up. Therefore, it is significantly less and much more affordable. That being said, tickle liposuction allows for us to tailor our consultation just for you. The price may vary from individual to individual. The reason being is some areas may be larger or smaller. Therefore, we have or provide a complimentary consultation just for you, which allows us to reach your goals. And therefore, utilizing this complimentary consultation, we can discuss what areas are required, and that's where the price base or price point comes in. You have to remember, you're paying for the nurse, the doctor, the procedure, all in one, which makes it much easier for you. This is affordable, and it's also an investment in you. People will pay for a vacation, but this is something that you paid for that you live with every day from this day going forward. It's an investment in you, and it's affordable. Considering cost regarding your surgeon, expect to pay a little bit more for a tickle liposuction surgeon due to years of experience as well as performing over 1,000 cases. You should consider a surgeon that has testimonials and before and after photos to back up proven results.